Hello out there and welcome to Public Conscience. This is the anti-corruption program produced by the Progressive Impact Organization for Community Development, PRIMORG. PRIMORG is a civil society group with a mandate to promote good governance, participation and accountability in Nigeria. I am Adaobi Obiabumo with Chidozie Ogbonnaya.
Welcome to the program.
On Public Conscience on Radio, we seek to evolve a corruption-free society through the amplification of corruption stories reported by our partner media organizations and drawing citizens and government attention for democratic actions against it. This program is supported by the MacArthur Foundation. Today's subject for discussion concerns every Nigerian and the image of our dear country, which is being undermined by some unscrupulous elements. You will hear how travelers can buy fake COVID-19 test results from government officials for at least 25,000 naira. So you need to get ready to join us through the phone and text messages. The WhatsApp phone number is 0902 265 6167. That is 0902 265 6167. Remember that this number is for messages only. On today's program, we will be looking at how officials at the Murtala Mohammed International Airport, Lagos, and Nnamdi Azikiwe International Airport, Abuja, collude with government officials to issue fake COVID-19 test results to travelers.
Recently, the Cable published a report which exposed how COVID-19 test racketeers at Murtala Mohammed International Airport, Lagos, Nnamdi Azikiwe International Airport, Abuja, and staff of Federal Ministry of Health collude to commit fraud and endanger public health.
The Nigerian Center for Disease Control, NCDC, had mandated international travelers to carry out COVID-19 tests, but fraudulent activities of these officials meant COVID-19 tests can be gotten without visiting any laboratory once the person is willing to pay the agreed fee.
Here are some startling findings exposed during the investigation. At the Abuja Airport, an official of the Federal Airport Authority of Nigeria was paid 20,000 naira, and in about 5 hours he produced fake COVID-19 test results which carried the identity of a government-approved laboratory and bore the signature of a senior medical officer of the lab.
Another senior medical officer who works with Port Health Services called the lab and negotiated from 40,000 to 25 for a fake COVID-19 result.
While in Lagos, according to Cable, fake COVID-19 test result was sent from a lab and allegedly signed by the laboratory's manager after the sum of 20,000 naira cash was paid.
Unfortunately, this web of fraud ongoing in our airports poses public health dangers. It undermines the credibility of COVID-19 results and labs across the country.
We have in the studio a medical doctor and the coordinator of the Africa Health Budget Network, Dr. Aminu Magashi Garoba. Welcome to the program, sir.
Thank you.
Dr. Aminu is also the global convener of COPASA.
We also have in the studio a reporter with the Cable, Chinedu Asadu. Welcome to the program.
Thank you for having me.
Chinedu, I'll start with you. The laboratories, according to the report, claimed the results bearing their identity were forged with codes of authentic results of other individuals. What is the level of involvement of these laboratories?
We found out that the test results was generated without the laboratory's consent, in the sense that the government officials involved, used the templates, the exact templates that the laboratory has. And so when we get that fake copy, there was no way to show that this isn't issued by the laboratory until we contacted them, and they told us that people are using their templates exactly as they issue it, with the signature of their staff, their logo and everything. to authenticate the results that are not genuine. So they had to deny, and subsequently they had to create a platform where people can authenticate the results they have. So if you say you got this result from the laboratory, you have to go to that platform to check if it's truly original or fake. That's after our report was published.
But the person who willingly paid for fake results, will the person go back to authenticate the results?
No, the person wouldn't go back, but that is also a step they took to just curb that practice.
Okay, we'll get back to you. Let's get to Dr. Aminu. You've read the report.
Yes.
How would you react to this corruption report done by the cable?
So it's good to commend the media, the cable, and all the vanguard of the media in Nigeria to continue to raise alarm of this kind of lamentable action by so many Nigerians desperate to travel. So we in totality condemn those actions, because whenever there is a problem, a lot of people need to play a critical role. The person that is desperate to travel does not like to follow the due process, to be screened and confirmed negative or positive. Then the person also supporting that individual is also creating more havoc to the society. And also remember that anytime the person is not tested, that means if you get the result without undergoing the test, it's either way. You could be positive, carrying the virus, or you could be negative, not carrying the virus. That is a public health threat, by that action. Because if you are carrying the virus and you get a fake, negative result, you will be able to cross all the airline, the security check, and you travel. In that process, you are actually spreading the virus, even inside the plane as you are traveling. Now, by the time you go to the country of destination and you are equally showing the negative result, you are positive, you are spreading the virus. That is a greatest public health threat that I want our Nigerians to understand. It's not only about the travel. If we are tested positive, we shouldn't travel. We shouldn't have that desperation that we must go to our own business or conferences. So we need to condemn this action in totality.
Thank you so much for that. I was going to ask you the health implication, but you've already enumerated on it. That the person that is desperate to travel does not want to go through the due process.
Exactly.
Thank you so much for that.
Doctor, just according to the report we are looking at, the government officials were involved in, along with the lab staff, just as he mentioned, but although they claim that they don't know about it. So to perpetrate these frauds, how can Nigeria address corruption in public sector, and what is your advice to the government on tackling corruption in the health sector?
This is a very good question, and let's build from that fake negative result. We can build fighting corruption from there. My understanding is the Nigerian Minister of Health, the NCDC, the port head, we should not be allowing private laboratories to be issuing certificate of negativity. They can do the screening, but there should be a uniform template in the country. Anywhere you go, there's one template, and that template has security checks. What it does, the way the ICT will help us to do it. If a laboratory A, B, C in Lagos, in Kano, Abuja is screening and issuing certificate of negativity or positivity, the template should be one.
The template
should be one. They should be given a template with a lot of security features that could be picked easily at the airport, so that even if you pay the money and you get screened, that template would be used to be certified that you are either negative or positive. This is a way to reduce. We may not eliminate the entire corruption, but if you have one template, you are already checkmating a lot of people that are playing a lot of games in the airport, even within the laboratory. The fake people, faking signatures and name, because they will find it difficult to issue one template. It can easily be picked, and you can just call the person and say, this is a serial number, have you issued this one? And the person could say no. This is, to me, one way to fight the corruption. Then at the same time, we shouldn't allow only the private issuing even the travelers certificate. Why are the government labs? So my understanding is the government labs, they can do the test, free of charge, but they cannot issue certificate. I think these are the weaknesses within the government cycle. Because if you go to many, states in Nigeria, a lot of evil labs are just gathering dust. People are not even coming for any testing. It means they can do the testing. So the capacity is to test, screen, and also issue certificate. So we need to really empower the public sector to also be able to do that, so that there will not be desperation, paying 20,000, 25, 40,000 to a private lab just to get a certificate for you to travel. So in summary, the one template for screening, for issuing certificate of negativity should be one and given to all the laboratories that have been accredited and approved. That way, to me, we can curtail the corruption in this process.
Where do you see the citizens in the drive and in the thriving of this corruption?
So it's a desperation, Before the COVID-19, personally, I travel almost twice a month. But once the COVID-19 started, I have to reset my brain that okay, let me stay in Nigeria until all the crisis is over. When we have vaccine and I got vaccination, then I can come back to my traveling. So this is the mindset, that desperation that we must travel to a conference, we must travel to a particular country, is what is also foiling this desperation from people. So I think the way to the Nigerian population, we are also contributing to the corruption, because we are showing that we must travel, even if you are positive. Can you imagine somebody knows that he or she is positive to the virus, and because you must travel, you go and pay 40,000 to get a fake certificate. And in doing that, you also engender your life. You're not only endangering the life of so many people. You are also endangering your own life, because you are going to keep spreading the infection. And
instead of treating
the infection, and at the end of the day, it could equally affect your family, or it could affect your neighbor or the co-worker as you are traveling. So I think we should discourage Nigerians for this desperation.
Nigerians should be discouraged from the desperation, and then there should be a single template cut across both government and private laboratory. Thank you so much for that. Again, your organization AHBD is saddled with the mandate of influencing policy and public spending on health. How do you rate Nigerians' handling of COVID-19?
So I think we have to commend the government, in some areas. The presidential task force with all the government agencies, NCDC, MPSCDA, the ministry, I think they are all trying to coordinate the COVID-19 response in Nigeria. We heard from the Minister of Finance just a few days back. I attended the virtual, public presentation of the budget by Mrs. Zainab Shamsuna, and she mentioned categorically clear that in 2021 budget, they did not allocate money for vaccine procurement. She made it very clear to all the participants for that virtual meeting, but she said there could be opportunity for supplementary budget from the Ministry of Health. But right now, in the 2021 budget, we did not allocate money for vaccine procurement. But she mentioned money for oxygen, money for maybe trying to begin to do research and development for vaccine. So it means that I think that is a weakness on the part of the budget. We already anticipate, COVID-19 vaccine in 2021. We must have planned to allocate adequate money. We shouldn't wait for donation. So right now, Nigeria, we're at the mercy of the donors. We are expecting donation all over the world. Yeah, of course, donation is good, but I always advise put your money at the table while you are getting donation. So we have the COVAX Global Facility, which is convened by WHO and the Global Alliance for Vaccine. They promised Nigeria 100,000 doses within the first quarter to vaccinate the frontline health workers. 100,000 doses in 200 million population. I'm sure you can imagine that we have a long way to go. So these are all the challenges that I hope that the government need to step up in the budget. And it's not only the budget, also prudent spending, accountability and transparency of the money from the Minister of Finance office to the AG office to the CBN and to the beneficiary. We call for 100% transparency of the finances.
Staying with transparency, Doctor, do you think this transparency held sway in the last 10 months that we've been battling with this pandemic.
So the transparency we need to step up. Like I said, the PTF task force always organizes press conference. I'm sure some of you are also attending. They provide some briefs. So this is commendable for you to continue to do that. But it wouldn't, before the press conference, we need to ensure that we're having constant information. Like, for example, this issue of corruption, about negative testing. If there's a proper coordination between the public and the private laboratories and the port health, center within the airport, we should be able to anticipate some of these excesses of people and also stop it. So really, I want to advise that we need to step up the openness of the entire process.
Thank you so much, Dr. Aminu Magaji. And thank you so much for your contribution.
Thank you very much, too. Thank you. God
Thank
bless.
you, sir.
Thank you.
You did the investigation. Please educate us what happened in the field.
Okay, thank you for that question. So I did the investigation. I did the Abuja, part of it, and why my colleague Taiwa Dibulu handled the part in Lagos State. And what we found out was very terrifying. We did it over a period of 3-4 weeks, and in the course of it, you see that the rot in the system is very deep, in the sense that there are lots of government officials involved in it, and it was a kind of racket. So it wasn't just a case of one individual, handling these things. So it's coordinated, and if you aren't careful, you're not even going to get to the source of where the test results are being generated. So you just see the airport officials telling you that they can do this for you. You don't have to worry. Someone even told me that he has done it for thousands of persons. So you begin to wonder, Nigeria has, if coronavirus has killed more than 1,000 persons in the country, and we've had lots of cases, more than 1,000 daily cases now because of the second wave, and you now begin to wonder, so where are these cases coming up? Why are people endangering people's lives? So the person I met at the airport, the first official told me that I don't have to bother about the test, that people are just using it to exploit travelers, that I should just go and don't mind them, and you wonder,
could you please say that again?
He was saying that I shouldn't worry about the test, that people are just using it to exploit travelers. I don't need any negative test results, that you can find my way,
But when you run the test, there's nothing to say that it must be negative. It's either it's negative or positive.
Yes. So the thing is, the man even believes that I don't have to do the test at all. You understand? So what we now found out was that, you have to do the test, quite alright, you understand? But you don't have to get your samples taken. You understand? We spoke to three government officials, that's including those from the Ministry of Health, who promised that they've been doing this for a number of persons, and we could just get ours I got mine within 4 hours, and he was sent to me via WhatsApp. So I paid the man 20,000 naira at the airport just around 8 p.m. later that day. He sent me mine. It was just like an original copy of the usual coronavirus test results people are issued, and my sample wasn't taken. I didn't visit any laboratory. I just had to part away with 20,000 naira. And lots of persons have been doing this from what we understood, because some persons have urgent engagements abroad. Some persons have they need to travel, and then when you go to get tests yourself and you're tested positive, out of desperation, you have to go and pay these people. And at first they would tell you, we don't do, there's nothing like that, don't worry, you just have to do your test and all. But then if they see that you are willing to cooperate, they can show you various ways that you can do it. Just pay the money and you get a fake coronavirus results. And these are government officials that even supposed to be checking that malpractice. So you are wondering, why is the system this rotten?
Test results, they all have codes, right?
Yes.
So if there's a uniform code issued from a central point for those who have done the test, will it remove the fakeness, if I would use that word, of the results?
Yes, like doctor said, that's one way that the government should consider, to check this, because the presented task force, after our report, they say they are going to clamp down on these guys, on the syndicates, and get them prosecuted, but they didn't say how they are going to do that. And doctor's suggestion is a very good one. So if there's a uniform code where people can verify the authenticity of results, one of the laboratories that their template was used told us that, okay, to check this, we've created a platform where people can authenticate copies of test certificates they got from us, but that's just for them. So what about other laboratories? There are lots of them accredited across the country. So if they are doing their own independently to verify, the authenticity of the result they have, the validity. How about other laboratories? So there should be a uniform process, a kind of template where if you key in this code, it should tell if this is truly from a government certified laboratory or if it was just generated independently by an individual.
In your report, you enumerated that these fake results, they used a template that was issued to somebody else with the same code. All they did was just to change the names on the results. So if you present that result, nothing shows that it is fake, except if they look at the code and key it into their system, they'll find out that the names are different.
But the problem is that there is no system, there is no process of verifying, the validity of these results, the authenticity. So they just have a template, and the logo and the signatures. At the airports, what they just do is to check, okay, is this signed, the date. So there is no process to even authenticate the results.
So those at the airport don't even check. All they need to do is, this is the result, and they are fine.
Exactly. There is no uniform way of checking the authenticity of results. So once you have the logo of an accredited laboratory and it's signed by anybody, once they see the name, provided it's a staff of that laboratory, there's no way to go and check if there's no process of checking, okay, is this truly from an accredited laboratory or was it generated independently without their involvement?
Okay.
All right, Chinedu, let's stay with throughout your research or your investigation, if I say that, did you reach out to relevant authorities, anti-corruption agencies, the ministry in question, Ministry of Health, or even the minister for response?
Okay, yeah, thanks for that question. So we got in touch with the Ministry of Health, asking them, telling them what we found out and, what they are saying about this, and they never responded, to date. But thankfully,
the Ministry of Health did not respond.
Yeah, their press units. But thankfully, as I speak to you now, the minister has set up a panel, an independent panel to probe the findings in that report, and the cable was invited recently. I think that was last week, where we spoke to them about what we found out, and some of the staff of the ministry and other persons that were implicated in that report we also invited as well. So we tendered the evidence we had, the videos of the persons collecting the money, the recordings, everything that's implicated them, in that illegality. We tendered it to them, and as they told us, they said the matter is taking the matter very seriously, and he constituted the panel to ensure that the right thing is done. And at the end of the day, if the persons that were indicted are found culpable, of course they are going to deal with them.
What of the airport authority? Did you reach out to them also?
The Federal Airports Authority of Nigeria, they've not said anything, today. Their staff. So what happened was because most of these MDAs are working under FAN. So the FAN official that we spoke to at first, so the man, he's working directly with the Port Health Authority, which is under the Ministry of Health. But all of these organizations, they are usually just coordinated by FAN. And so it's still linked to the Ministry of Health. That was why we had to just speak directly to the Ministry of Health to know what their response is to the issue. But FAN hasn't taken any measure as of today regarding our findings. Nothing official has been done except what the Presidential Task Force said, that they are taking appropriate measures to ensure that the persons involved, they are tracked and they are prosecuted. So yes.
Your meeting with the Ministry of Health happened last week, right?
Yes.
Up until now, any other development on the issue?
So we've not heard anything from them. Okay. The panel there are about 10 members of the panel, and we tendered out the evidence they asked for. Evidence showing that these persons truly did this. The phone recording where they admitted that they can do this. Even the medical doctor, a senior staff of the ministry, was saying that he's doing it for lots of persons, that I should not worry. That if I pay him, he will send me my test results. I can go anywhere with it. I should not worry, and all of that. So all of those phone conversations, we send them to the ministry, and we've not heard anything from them since then anyway.
Okay. We'll still get back to you, but before then,
one would have thought that by now
the ministry
somebody moving on them when you have video evidence and all that.
Okay. Time for us to get our listener to join the conversation.
Yes, the WhatsApp phone line to send your messages.
0902-265-6167. That one is for messages only.
And your reaction will be what you've heard, and have you had similar experience, and what are you doing as a citizen? against any form of corruption around you.
Dr. Aminu Magaji did mention that one of the reasons why Nigerians go all out to get this result is because they are desperate. How many hours does it take to get the COVID-19 test result ready?
So we checked our findings, and from what we discovered, it usually takes, from the private laboratories, we get yours in 24 hours. So I eventually did my own tests, after that incident, because I needed to check. Yeah, I needed to check.
You exposed yourself.
I was exposed. So I got mine the day after, just about 20 hours after. Although they will tell you it will take 24 to 48 hours. But unfortunately, that's just for the private laboratories. So most persons that go to the government labs where they can afford, because it's free. A friend of mine, it took her a week. Some persons have complained that it takes as much as 10 days. And so that's where you see the problem in the system. So most persons, the testing is now a sort of for the privileged few, those that can afford 40,000 naira to cough out 40,000 naira to do the test in the private labs for 24 hours.
What of government labs?
Government labs is free, but I don't know why someone would have to wait for a week to get, the result of your test. So within that week, what's happening? So what are you doing with your life? Are you not still going to work? Are you not still going to be going out? This is like most persons that can't afford that. You can't ask a person to self-isolate in their home for 7 days, just waiting for their test result to come out. Most persons will still go out and go to school or work, depending, and that's still endangering people. So I think the government has to do something in that regard to fasten the process. 1 week is too long to wait to just get your test result. Within that period of time, if anything is going to happen, the virus must have manifested in your system, assuming you have it. So it's very, very dangerous for the the health of the person, and I think that's why most persons would even resort to getting a fake test, knowing that you need to travel, you don't have 40,000 naira to pay the private labs, and the government is taking forever to get you. So why can't I just pay 20,000 naira to get mine within 5 hours? So
but if you know you're going to travel, it's not as if it's you just found out. Probably you planned towards it. Why wouldn't you run the test like 2 weeks before? If government hospitals take 5 days,
they normally give them specification when you are traveling. Chinedu, correct me if I'm wrong.
The week you're traveling, 48 hours before you travel.
Yeah, and moreover, some trips aren't planned, so sometimes you could get invitations to conferences or for some programs that are some kind of impromptu, and you just have to get your result as fast as you can. So if you don't have that luxury of time to do yours, in a government lab that will wait a week, and the private labs are there, to offer you
40,000.
But it's 40,000. So how many persons can afford it? You're talking about the poverty capital in the world. How many Nigerians are even living below $1, in a day?
But for someone who is traveling abroad, it's 40,000.
Most of these trips are funded. There are some persons that are traveling. I've traveled abroad for some funded trips, and it's not a question of someone traveling abroad. Most times you don't even get to spend a kobo for what you're going for, especially if it's maybe conferences or similar engagements related to work. So I think we should start talking about a system that will be affordable for Nigerians, and not just the luxury of traveling.
Government officials, government laboratories.
Yes.
Yes.
5 working days for the results to be ready.
That's the least, I think, because someone said they got theirs for 10 days, and it's a big problem because you're wondering what is happening in the life of that person within that 10 days. You have to go to
if
work.
The person is already infected.
Exactly. So how many of you are able to leave you to just self-isolate for 10 days or thereabouts? You have to stick. If you're a student, you have to return to school. Schools are resuming now. So why would someone have to wait for 10 days? And remember, while you are self-isolating, you should take some precautions to ensure that even if you had the virus, that your system is very much strong to responding to it. So but you may not be able to do that because you are just waiting to be sure whether you have it or not. So it's such a long time, and I think it's also part of what's contributing to the high number of cases we are seeing.
Yeah.
Because most persons wouldn't want to stay back at home and isolate for 10 days. So you'll be tempted to go out, to go to the market, to go to school, to go to church, and for some other engagements. So it's a big problem that the government should respond. We've tested just about 1.1 million samples, and that's very much far from what should be the case. Almost a year after the pandemic, we are just talking about 1.1 million out of 200 million population. So we still have a very long way to go in terms of testing and in terms of managing the cases we have.
Okay, thank you so much. COVID-19 fake results. How Nigerians are desperate. We need to get this test result out. Could it be the reason why there's a spike in the COVID-19 cases?
I mean, Dr. Magaji touched on it. He pointed out desperation. Chinedu, let's go ahead with the investigation. With what you came out with, it confirms that corruption in the public sector flourishes with collaborative efforts.
Yes.
What ways can the government best fight this ongoing falsification of COVID-19? You've touched on it anyway, but other COVID-related corruption that you are aware of?
Aside that of testing, you're also looking at case management. So the cable is working on a report now, should be out anytime soon, and we're looking at how the high cost of getting a treatment, getting treated, for when you are tested positive for coronavirus. So you see, in most cases, if you can't afford, not even if you can't afford, in most government facilities, you see that the care, the level of care there is almost nothing compared to what you could get in private hospitals. So people would want to get that care, as very much important as it is, and it's costing a lot. It's costing an arm for some persons. So I think there should be a way to regulate what should be required. The highest that the facility could charge. Yes, it's a private facility, but then it shouldn't be a means of extorting people. So a colleague was talking about where he's asked to pay 1 million naira to get admitted, as a coronavirus patient.
Where?
For real?
Yes, in
Where?
Lagos.
Private facility.
A private facility. So there should be a way for the government to regulate this thing. So I know it's your business, it's a private entity, but then you can't just run it anyhow you like, because this is at the expense of the citizens. So you're not just talking about the testing, case management as well. How are people being able to afford the the drugs and the attention they need in the hospital? So even if we are isolating at home, some of the drugs are very, very at exorbitant rates. You go to facilities where they have been. So there's no drug for coronavirus, by the way, but I'm talking about some supplements that some doctors have recommended that could help boost your immune system. And the prices are just going high every day, and there are government agencies that should regulate these things. So there should be a way for the government to ensure that the citizens are not being extorted because we're just fighting a pandemic. Because at the end of the day, you're making the whole thing worse for both the citizens and also the person that are involved in all of this.
With the investment in COVID-19, you look at the funds we've put into this in the last 10 months, and does it mean, because I asked Dr. Magashi the same question, does it translate, that you go out, you're on the field, does it translate with what you see? Because these private laboratories will charge up to 40,000 for a test. It doesn't mean we cannot subsidize this with our investments into COVID-19 fund.
So unfortunately, from what we found out at the cable and in similar projects, we see that in most cases the funds that go into the response to the pandemic, they are usually diverted, in the sense that you see in the procurement process, someone is budgeting as much as say 500,000 naira for face mask, a box of face mask that you could get for maybe 50,000 naira. So you're wondering that there's lots of things going on in the procurement process. Most of the MDAs are just trying to cash out, in the pandemic. So if you look at the budget, it's a public document, it's easily accessible. If you look at some of the procurement that have been made, you see very, very much bloated sums of money, being allocated for things that they could be gotten at very, very lesser amount of money. And you're wondering what's happening. So you come to say Nigeria has spent 1 billion naira in procuring PPEs, but when you look at the breakdown, you see that face shades that could be gotten maybe at 500,000 naira, for a particular quantity. You see someone budgeting 2.something million naira. So at the end of the day, there should be a way to check all of this. Much of the corruption you are seeing is in the procurement process, because every MDA is trying to cash out, every MDA is trying to take as much as they could. The contractor that is being awarded the contract, some of them that are not even qualified, because we have a court to give back to the ministry or the department or the agency that is awarding that contract. So we should be talking about investments if they're even going to where they should be going to in the first place. So when we say Nigeria has spent a particular amount of money, how much of that money is being used for this, for the purpose that it's meant for? A lot of it is just, being diverted. People are preferring public funds just to ensure that they get as much as they could. So it's an opportunity for most of these MDAs to just get as much cash out from the pandemic, knowing that there isn't a proper check to know, okay, there should be a limit to how much you're spending for PPEs. I don't understand how you'll be budgeting as much as millions of naira for something everybody knows that you could get this at a way less. So why are people, why are Nigerians, why are government agencies, what are the anti-corruption agencies doing to check this? But it's almost like a norm. I mean, it's always the same case, not just for this period, since the budgeting process. You see, as far back as many years ago, you see that if you look at the procurement process, a lot of the funds are just, multiplied by how many, just to make sure that there's enough left for the contractor, for the awarding MDA, and nobody is talking about all of those things. So I believe Nigeria has, I wouldn't know how to rate the response generally, because a lot of things come into play, talking about testing, talking about case management, and then our epidemic preparedness. But overall, I think we are not putting enough money, into this response. I don't know why citizens have to pay as much as 40,000 naira to get a test, or why they would have to wait for as much as a week, to just know your diagnosis. It's such a long time, so the money isn't going into where they're supposed to go. So if you're talking about how much you spent, we should be talking about, are they used for what they're supposed to? What are the results? What are the outcomes?
Used for what
exactly,
they are meant
almost
for.
a year into the pandemic, what are the outcomes, in the investments, and not just about how much you spent.
So there's no value for money?
I don't think there's enough value. There is a value for money, but there is not enough value. Talking about what should be the case.
All right.
Okay. Have you done a COVID-19 test? What is your experience? Would like you to call and share your thoughts with us. We've been speaking with Chinedu Asadu. He is a reporter with The Cable. He did this investigation on fake COVID-19 test results issued by some officials at the airport in collusion with some officials at some approved medical laboratories. Chinedu, will you go back to the airport to see if these sales are still ongoing?
We've had some sort of measures in place. We are in touch with our sources, we are in touch with our people at the airport to see, so if what the authorities promise that they are doing, are we seeing the results? And of course, we know that the tests are still ongoing, because the persons that are implicated in that report, they are still there. They are still at the airport, and it's not something that
they are still at the airport,
yes,
collecting more money.
I wouldn't know what they're doing, but they are still at the airport. It's not something that you just hands off immediately, because it's not just one person involved. It's like a syndicate, including private individuals and government officials. So it's something that the government needs to act very fast on, because we're talking about lives here, we're talking about public safety here. So if the ministry has said probing the incidents, if the presidential task force has told us that they are going to move fast and clamp down on those involved, how long is that going to take? They made that promise for more than 2 weeks ago, and up till now we've seen a spike in number of cases. So why aren't they acting fast? Could it be that somebody is trying to hinder that process of investigation? So who is trying to prevent that, if that is the case? So they should act very fast. So we shouldn't even be talking about if the process is still ongoing at the airports.
All right, Chinedu, but let's get the citizens part of this issue. Lastly, how best can citizens get involved in the fight against corruption on this COVID-19 test and on general notes?
So I think whistleblowing is one of those things that we should take more seriously in this country, because interestingly, before we even did that investigation, we've seen reports on social media where people are saying they know someone that did, that got a fake coronavirus test. That was even the first place we pick the information before we start getting intel from our sources. So if people know that this thing is ongoing, if people know that there are some officials involved in this process, what stops you from alerting the necessary government agencies? There are whistleblowing platforms. They could even alert the Cable or similar other government agencies. So why are people keeping quiet? Sometimes through our inactions we tend to,
or you can even call Primo.
We tend to condone corrupt practices in the country, because one way or the other we are going to benefit. So you have a friend of yours that is traveling and he just tested positive, and you're advising him, I know someone that got a fake coronavirus test. So why are you trying to condone that corrupt practice. So most times I think we have to really take more seriously whistleblowing in this country. And then talking about desperation, I don't see the need to be so desperate to travel out during the pandemic when you know that you're a public threat, to travelers that you're going to go with, to your colleagues at work and some other persons you're going to meet along the route. So it's a big problem that I think people should take more seriously. And unfortunately, some persons don't even believe that there is coronavirus. That's why somebody would easily go and obtain a fake coronavirus
Is the sensitization not enough for the person to believe that there's COVID?
I think it's enough. There is this communication. It's been there for some time. But then there are some persons that you can't even, if you like, talk from now till tomorrow. You can't just, because of course you're talking about the high level of distrust in the system. Some persons don't believe that anything good could come out of the administration or Nigerian government, even if it is APC or PDP. So with that kind of mindset, even if they tell you that there is this number of persons that have tested positive or this number of deaths, you want to argue. But that's not to say that there shouldn't be a case to interrogate what the government is telling us.
People are dying even outside Nigeria, in African countries.
In Nigeria, people are dying of
COVID. You know someone that have died in your family, and you only but see someone, you are telling them, I think leave that thing, it's all fabricated. So there's a high level of distrust, and I think that's what is even pushing people to even go into some of these illegalities. But then, like I said, you keep sensitizing them. The risk communication keeps going. You can't say because people don't believe in coronavirus, you should stop enlightening them. The media still has a lot of work to do, and I believe we are doing much in Nigeria. I wouldn't be in a better position to rate the risk communication coming from the media aspect, but I think we are doing much, and you just left for the citizens to take in and then participate in the process as well. Tell people, if you have the virus, it's always good to share your experience. What was it like in isolation at the hospitals, in the treatment process, all of that. Some persons would recover and they wouldn't, especially for the celebrities as well. So I don't know why celebrities only tell us that they have the virus after they've recovered. What stops you from telling your fans? It's also important to enlighten them to understand that this is real and it's fake and I'm having it at the moment. So it's important to just let them know and not after you've tested negative, you come out and say, coronavirus did that, you say I almost died. So why didn't you tell us when you tested positive in first instance? So it helps in that enlightenment process as well. So it's like a collaborative effort from the government, from the citizens, celebrities, and the media as well.
Collaborative efforts from the citizens, government officials, the media. Have you done a COVID-19 test? Did you pay for money? I know so many people wouldn't want to call in and say, oh, I paid. But it's good to tell us because it's fraudulent. We're not coming after you as prime work. We don't even know your face. We can't see you. We can only hear your voice. We want you to share your experience. Maybe some officials, government officials, don't even believe that there's corruption in the process. Talking about COVID-19 test results. But when you share your experience, it will help to inform the government officials that they need to take this thing seriously and investigate. We have a caller. Hello. Name and where you're calling from.
Okay, my name is ONWE Only William Uchechuku.
Go ahead, please. We can hear you.
Okay, I'm calling from my today.
Okay.
I have done my own COVID-19 test. That was last year, November, I think.
What was the experience?
I don't know. I did it in, I think, in a private or different lab at the side. There was nothing difficult or nothing to be afraid of them. The way they were doing it. But to my greatest surprise, up to now, I have not seen the results. No call, no nothing, no any idea whether I have it or I don't have it. Whether I have it, whether I isolated myself.
Just hold on. You said you did the test when?
Yeah, that should be November.
You did the test since November 2020. And today is 20th January and you've not gotten your test results.
No test, no call, no email, no nothing.
Did you go back to the lab?
But yes, I went to the lab. I did it in the lab there.
Since you've not heard from them, did you go back there?
No, because if you go there, they will ask you what you come to do.
But you've come to get your results.
No, but you need to get your results. did you pay, and how much did you pay for the test?
No. They never asked me for 1 naira, not at all. Not at all.
Then it must be a
That's
government.
not good enough. That's not good. Thank you so much for your contribution.
Must be a government law, but he should have gone back.
He should have gone back since November.
Yeah.
And
Quite a long time.
Chinedu, what do you have to say?
I think it's part of the problem, so there should be a way to ensure that the right thing is done. If someone did a coronavirus test since November, I mean, he must have recovered by now, as mean he had.
If he had the virus.
2 months plus, so I don't know. If it's a private lab, he should have gotten his test result by now. If it's a government facility, it's similar to the issues we've been hearing from.
Let's take this other call. Hello. So your name and where you're calling from?
My name is Atilade.
Go ahead, please.
The man that said he did his test in November, the son is more earlier. I did my own September treatment specifically.
When did you run your own test?
Federal Medical.
What month?
Come again?
What month?
September 15 specifically.
And have you gotten your results?
From where? I went there twice. It's not ready. I don't have time to wait. And I was actually very down. Doctors could not describe what exactly was my problem then. And it was the drug that cures me, corona that cures me that period. The chloroquine, what did they call that? They do sell 250 naira. We bought it 6,100, just a sachet. And to the glory of Almighty God, I was healed. And all people, my daughter and my wife, were taking care of me to the glory of Almighty God. Nobody was infected. That is why some of us hadn't believed that this thing they are calling corona might be real or not. And we just gave the name of the Lord. All tests were done in the hospital, general hospital specifically. But I bless God. We went to Federal Medical, instructed by the doctor to go and conduct the test. We conducted it myself and my wife to get the serious side. Up till now, no call, no text. I went there twice. They were telling me that the result was not available at that time. So what can we say about our country, Nigeria? I know we help us.
Thank you so much for sharing your experience. Someone who did a test in September and up till now he has not gotten his test, and the first caller said he did his own tests in November and he didn't get his test results. That is not particularly nice. And thank God that you're healed, you're fine. Thank God for your family. Thank God you are alive. And that's how we are wrapping it up on today's episode of Public Conscience.
Please visit the news page of our website, news.primorg.org. That is news.primorg.org. Once again, Primorg is spelled Primorg. Visit the news page of our website for all the details of our report and interviews.
And you can watch our videos on Primorg TV, our YouTube channel. Please subscribe to get reminders whenever we have a new post. And we sincerely appreciate our guests, Chinedu Asadu from The Cable, and Dr. Aminu Magashi Garba, the coordinator of the Africa Health Budget Network and global co-convener of COPASH. Thank you so much, Chinedu.
Thank you for having me.
Public Conscience is supported by the John T. and Catherine V. MacArthur Foundation, committed to building a more just, verdant, and peaceful world. Get more information about the foundation on its website, macfound.org.
Join us again here next week for another interesting episode of Public Conscience. And remember to follow us on our Twitter, Facebook, and Instagram at Official Primorg. I am Chidozie Obunnaya. Remember
that you can give us information or hints on Corruption Act through our phone 0902 265 6167 or info@primorg.org. As a citizen, you have the mandate to hold elected officials to account. I am Adaobi Obiabumo. Stay safe.